Since 2013, the Pug has remained in the top 40 most popular dog breeds in America, according to the AKC. But did you know that despite their immense popularity, Pugs suffer from an immense amount of health problems and are widely considered in the vet profession as being one of the most disease-stricken breeds in the entire world? These dogs oftentimes cost their owners multiple thousands of dollars worth of veterinary bills. But do you know why that is, though? In this video, I'm going to explain some of the more important and common health problems facing the Pug. And I'll break this down by major systems, just like I did with the French Bulldog video, so go check that one out if you haven't already. We'll start with the respiratory system, then we'll discuss ocular disease with the help of my colleague, veterinary ophthalmologist Dr. Alex Sigmund. Then we'll cover my specialty, their nervous system, and then finally another consultation with veterinary dermatologist Dr. Ashley Bourgeois, aka the Derm Vet. Now, I can't cover every single health problem in this video, but these will be the major ones. And if I forget something, feel free to comment below. More importantly, though, I'm going to explain why these problems are so prevalent in this particular breed, and I'll give you a hint, it's not just bad breeders. If you've heard about pugs and their skin fold issues and their breathing issues and you're not sure what to make about all of this, then this video is for you. If you're thinking about purchasing a pug and you're not sure who to believe in regards to all the health problems that you've heard about, this video is also for you. And guys, quick disclaimer, please, again, make no mistake, just as with my French Bulldog video, this is not me hating on or making fun of these animals. It's quite the opposite. I see pugs in my practice all the time, and I always do everything I can in my power to try and help them live a more comfortable, mobile life to the best of my ability, and I want them to be healthier than they currently are, and you'll see what I mean in the video. Before I get into that, please hit the like and subscribe button. Help me grow this channel. If you're not subscribed to this channel, please hit that subscribe button. Definitely appreciate that. We're trying to grow the subscribers here. Let's begin. Much like French Bulldogs, Pugs also have a skull and muzzle that is described as brachycephalic. To review, brachycephaly refers to the shape of a dog's skull, and brachycephalic dogs and cats have a shorter muzzle and a more broad, flattened skull shape. Some breeds like boxers, for example, are what I like to call lightly brachycephalic, i.e. not too extreme featured in this regard. But then there are the extreme brachycephalic breeds like pugs, French bulldogs, and English bulldogs. Their muzzles are oftentimes non-existent and their faces are completely flattened. As I've mentioned before, extreme brachycephalic dogs such as pugs take advantage of what's called Kindon schema, whereby the appearance of these brachycephalic animals takes on that of a human infant, and in turn, we humans automatically have a positive and nurturing response that we put towards that animal. In other words, pugs look more like infant babies than, say, a husky, and that makes our brains say, oh, I want to love that pug. Quick side note, though, I personally find this entire thing quite creepy when I hear people talk about Kindon schema like it's a good thing. It's beyond my understanding, but moving on. To reiterate what I've said previously, brachycephaly is not something that occurs in wild dogs or wolves, to my knowledge, and this skull shape is the result of a combination of domestication and artificial selection, i.e. breeding for these features. Pugs originated in China about 3,000 years ago, and they were bred for the Chinese imperial court. They were brought to Europe in the 16th century and eventually America by the 19th century. Paintings and photographs of pugs from long ago show dogs with much longer muzzles compared to today. Indeed, it seems that over the years, much as with bulldogs, pug features have become more and more extreme. Images of pugs from long ago show them to be much less brachycephalic compared to today. The Pug Dog Club of America describes the breed standard of a pug to have a massive head and a muzzle being flat when viewed in profile. It also says the muzzle is extremely important, which I find ironic because the images of pugs on their website illustrating this breed standard have no muzzle whatsoever from what I can tell. Pugs are considered an extremely brachycephalic breed, and that segues nicely into a discussion regarding the first system that I want to discuss, which is their respiratory system. For a dog to both breathe and regulate body temperature normally, they need air to flow without turbulence through their nose and down into their lungs. The image on the left here is from a paper published in 2021, and it does a nice job highlighting the major anatomical regions of a dog's upper respiratory tract involved with a sense of smell and respiration. This is a dog with normal nasal and skull anatomy. You can see the difference in the extremely brachycephalic bulldogs shown on the right. Extremely brachycephalic dogs have all of that bony cartilaginous tissue inside the muzzle and skull compressed inward. The soft tissues in there, like their soft palate, do not scale down in size appropriately with this skull change. And the chamber that's supposed to allow air to flow through and cool can't, or if it can, it does so with a lot of turbulence. And this air turbulence is the source of the snorting noise many of these dogs make when trying to breathe. This is not normal, and it's indicative of an animal that cannot breathe normally. This feature is broadly normalized in society as simply being a pug. And as an example, here's a fun little fact I discovered in my research for this video. A pug named HYSA was used for sound effects for the video game Halo Infinite, and apparently the sounds it and many other pugs make closely resemble aliens enough making grunting noises to use in a major video game.
There are no small parts, only small actors. I love that.
Isn't that great?
And pugs are very alien-like. Like of all the dogs out there, they're very alien.
So cute, too.
So cute.
Now, I don't know what the developers' knowledge of pugs were and what their intentions were in regards to this pug's respiratory health. My guess is they just figured it's a pug and this is just what pugs do. But that's kind of the entire problem. This entire spectrum of altered respiration is referred to as brachycephalic obstructive airway syndrome, or BOAS. BOAS has enormous consequences to a dog's well-being. Imagine, if you will, living your life with your nose pinched closed and a straw in your mouth as your only source of air, and you kind of get the idea. It's also a progressive condition. It gets worse with time because the effort required to suck in all the air damages the soft tissues of the oral cavity in the throat, which snowballs the problem. This condition puts these dogs at risk for life-threatening complications like heat stroke and pneumonia, makes them much higher risk for anesthetic death and other complications under anesthesia, and it oftentimes massively complicates these dogs when they come into the clinic for completely separate problems. They come in for an injured paw, and the pain of the injury combined with stress of the visit puts them in a respiratory crisis that threatens their life, and it also ends up costing their owners a lot more money. It's estimated that around 50% of pugs have clinically significant BOAS, but some estimates are much higher than that. It's hard to know exactly what the percentage is, but what we do know is that breeding for these extreme features predisposes. A study in 2015 from the Royal Vet College in the UK looked at facial conformation and risk of this BOAS condition. They looked separately at two groups of dogs, one consisting of 700 dogs representing all sorts of breeds coming into the hospital, and a second group consisting of brachycephalic dogs. In both groups, they found that BOAS risk increases sharply in a non-linear manner as relative muzzle length shortens. BOAS only occurred in dogs whose muzzles comprised less than half of their cranial lengths. Contrast data such as this to the pug breed standard, which in my opinion clearly lays out a recipe for the skull and facial features shown to place these dogs at risk of this BOAS condition. This image is directly from the Pug Dog Club of America Illustrated Breed Standard. This dog has next to no muzzle whatsoever. Whether or not this specific dog or any pug you know has breathing issues in and of themselves is irrelevant here, although there's a good chance that they do. The point here is that the practice of creating these dogs with this goal in mind is what will invariably create swaths of dogs with a lifetime of morbidity directly related to their shape. And that begs the question, why are we okay with this as a society? Now, if you want, I can make a video dedicated only to BOAS where I can go into more detail, but suffice it to say, the condition really affects their welfare, and in my opinion, the breed standard is largely responsible for this. Okay, moving on to ocular disease in pugs, here is veterinary ophthalmologist Dr. Alex Sigmund to discuss pug eye issues. Take it away.
I'm Dr. Alex Sigmund, and I'm a veterinary ophthalmologist. Regarding pug ocular disease, we unfortunately have a lot of research that supports that these dogs, this specific breed, has a lot of eye problems. The most common thing that we usually see is something called pigmentary keratitis, and that is where brown pigment is starting to grow into the cornea due to secondary inflammation. Now, that inflammation could be just from chronic exposure because these dogs also have very large eyelid openings, which makes their eyes more prominent, more exposed, and more likely to be irritated. They also have issues with the lower aspect of their lower inner eyelid that can roll in, called entropion. And that entropion causes hair to start rubbing onto the eye, either constantly or positionally, depending on how the eye is looking. And that chronic inflammation can then lead to progression of this corneal pigmentation. There's also some support that this corneal pigmentation can be genetic, because we do see pugs without any other issues with their eyes still develop corneal pigmentation. While that corneal pigment is not painful, it is progressive and can cause vision loss. And addressing that corneal pigment can be challenging because we're not exactly sure what it is. Is it a genetic issue or is it a conformational issue? And so sometimes these dogs just need eye drops, but sometimes these guys need some types of surgery. Now, the lower entropion is something that we can address with surgery, but it's a kind of a hit or a miss whether or not that's going to affect the corneal pigment. These dogs also are prone to corneal ulcers. Pugs have probably about a 13 times greater chance of developing corneal ulcers compared to non-brachycephalic breeds. And in some papers listing brachycephalics within that breed, pugs have been listed as one of the most common brachycephalic breeds affected by corneal disease. So pretty much any corneal surgery, corneal repair paper that is published these days mentions brachycephalics as the most common, but then also mentions pugs as also one of the most common within that section. So these dogs have corneal pigmentation, they have eyelid abnormalities, they have exposure of their eye from too large of eyelids, and all of these things are secondary, frankly, to their smaller head size, their smaller snout lengths, and all of that leads to chronic disease with their eyes.
All right. Thank you, Dr. Sigmund, very much. Guys, go give him a follow on Instagram. He's at the Vet Eye Guy. He posts all sorts of great content related to animal eye disease. All right, now let's move on and talk about my favorite neurological disease in pugs. There are two neurological diseases that pugs are known for, not the only ones they get, but these are the ones they're known for. One is what's called meningoencephalitis, and the other is what's called pug myelopathy. So let's get into these. Meningitis means inflammation in the meninges, the covering of the brain and the spinal cord. Encephalitis means inflammation of the brain, and meningoencephalitis means inflammation of both. In general, in dogs, meningoencephalitis is an autoimmune disease, not an infection as far as we know. That means that when we see it, which is pretty common if you practice neurology like me, a dog's immune system is attacking its own brain. A little bit different from meningitis in people, which is usually an infection. We call autoimmune meningitis of unknown etiology, or MUE for short. And I'll say MUE from now on because it's a lot easier to say. Pugs are one of the most common breeds to suffer from MUE, and it's reported that 1.2% of all pugs die from this condition. MUE presents mainly as symptoms of brain dysfunction. Symptoms like seizures, depression, abnormal gait, circling in one direction, blindness, and other symptoms of just overall neurologic dysfunction. It's treatable in some cases, many cases, but also many times it's fatal even with aggressive therapy. And if dogs do recover, they're often neurologically compromised for life. This whole process, the diagnostic workup, MRI and spinal tap, the treatment of it, which can go on for weeks and months and sometimes their entire life, the husbandry at home, puts a huge emotional and financial strain on these pugs and their owners. And these images right here are MRIs from a study published in 2017 showing this disease and what it looks like in a pug's brain. See all that white stuff interlaced around and in the right side of the brain? That's inflammation, and that's what this condition looks like on MRI. Now, UC Davis offers a genetic test for this condition with a positive, meaning that the affected pug is 12 times more likely to develop this MUE condition. Now, fortunately, the Breed Club recommends this test, and it's considered mandatory for what's called CHIC certification. I think that's great. So they're doing a good job there with that. Credit where it's due. And a little bit of advice here. I personally, maybe I'm biased because I'm a neurologist, but I would never get a pug unless I knew their genetic status for this MUE condition. Now, the other neurologic disease pugs often suffer from is of spinal origin, and actually there's two of them I want to mention here, so let's get into that real quick. The first is the fact that pugs have a very high rate of congenital spine malformations, meaning abnormal anatomy from birth of their spine. A paper published in 2017 looked at a population of 68 pugs and found that 17% had what are called hemivertebrae, which is basically a vertebrae that doesn't form completely. And over 30% had spina bifida, which is failure of the top of the spine to fuse together. The result of these malformations can be spinal scoliosis or kyphosis, which is basically a kind of curvature of the spine in different directions. And this can result in the spinal cord getting pinched at the apex of the hill of this curvature. And when the spinal cord gets compressed at this level, the pelvic limbs become weakened and coordinated, and the pug's mobility is compromised probably forever. forever. Urinary and fecal incontinence can also come about, and both of those things are huge quality of life determinants. There are some surgical procedures that can be done to fix these spinal malformations, but they are really complicated and they require a very high level of cost and expertise with oftentimes kind of questionable prognoses. These spinal malformations are sometimes seen as incidental and occurring in normal pugs, and indeed, I'm sure there are some out there who would consider this as normal for a pug. But just because these malformations are common does not make them normal. Just ask anybody with scoliosis, for example. Would you prefer to have this or to not have this? I think that's a fair question to ask and apply it to pugs. Furthermore, a study that looked at 550 pugs in Sweden found that 30% had an abnormal gait, the majority of which were due to neurological dysfunction. So in other words, 30% of the pugs surveyed in this study had clinical evidence of spinal cord dysfunction when surveyed at large. And this gives you an idea as to how common these sorts of spinal problems are, and again, how many times we're just kind of normalizing disease. The other major spinal disease that pugs develop is what's called pug myelopathy. I wanted to mention that in this video too. Myelopathy just means spinal cord problem. That's all that word means. Pug myelopathy refers to a condition in which the spinal cord becomes circumferentially, meaning like around the entire thing, pinched by scar tissue or compressed by a cyst developing in between the spinal cord and the fibers covering called the dura mater. So I want you to think of like a sausage with a casing around it. The dura mater is the casing and the spinal cord is the meat. And the potential space in between there is where these problems lie. And in either case, the spinal cord, sausage meat, gets compressed, okay, and that results in weakness and incoordination and oftentimes urinary and fecal incontinence and sometimes back pain. We don't know why the condition develops, and we also don't know why pugs seem to be way overrepresented. They're not the only breed that can get this, but pugs are by far the most common kind of classic breed that gets this problem. But we do know that this is the most common cause of pelvic limb neurologic dysfunction in older pugs. This video right here is from the YouTube channel of Southeast Veterinary Neurology. This is a very well-respected veterinary neurology group based mainly out of Florida. They have many practices there. And I got permission to use this video, but this is a good example of what these pugs look like. You see how the pelvic limbs, back legs, are a little bit wobbly and weak? This is how these pugs with these pug myelopathy problems present. So if you see your pug starting to walk like this and they're above the age of about 6 usually, please be aware that this might be what's happening, this pug myelopathy, and seek input from a vet neurologist, not a chiropractor. Chiropractors like to see problems like this and pretend like they know how to fix it with spinal manipulations. I would consider that a contraindication. So please don't pursue chiropractic work if your pug is walking like this. Now, the pug breed standard calls for, quote, large and deep head wrinkles. And as you can see, this encourages these wrinkles to partially fold over the top of their nose. So touching back on their respiratory system again, they've got hardly any muzzle to speak of. And what we're doing with what's left of their muzzle is taking a skin fold and kind of folding it over. Seems kind of risky to me. Now, skin folds like this are a recipe for infections and chronic inflammation of the skin. And these are seen in pugs all the time. Now, I'm a neurologist, which is about the polar opposite from a dermatologist. I'm certainly not an expert when it comes to skin disease in dogs. So I thought I'd ask for another consultation here. So here is veterinary dermatologist Dr. Ashley Bourgeois with a summary of the skin problems that pugs face.
Oh, pugs. I am a board certified veterinary dermatologist, and pugs are so cute and I love them. But I'm here to tell you they are definitely susceptible to skin issues. Two of the main things I think about as a dermatologist when I see pugs: one, skin fold dermatitis. So just based on being more of that smushed face, what we call brachycephalic type of dog, they have lots of skin folds. And I tend to see a lot of secondary bacterial infections and yeast infections within those skin folds, based on the friction and the debris and stuff that can get caught in those skin folds. So we have to make sure we're wiping them down and just know that this is a breed that is definitely susceptible to getting skin fold dermatitis. Maintenance can definitely be a lot, but it can be very, very helpful and beneficial. The second thing I think of, and it's something I see a lot of as a dermatologist, allergies. Pugs are definitely a breed that we see predisposed to allergies, which is one of the most common skin issues we see in any dog. There's 3 main types of allergies we see: flea allergic dermatitis, food allergy, and environmental allergies. So these allergies can cause pugs to be very itchy, lick and chew their paws. Also can work against us if they have allergies in those skin folds, because allergies also predispose these pugs to infections. So if you have allergies in the skin folds, you got 2 things that are gonna fight you against those infections and have them developing over and over again. We also see ear infections in a lot of pugs associated with the allergies that they have. So it's something that you definitely have to be aware of with pugs. Those skin folds, that genetic predisposition to allergies is something that often bring our little pug friends into the dermatology clinic.
Thank you, Dr. Bourgeois, for that. Guys, please check her out on Instagram. She's at the Derm Vet. She posts all sorts of useful info regarding skin diseases in dogs for pet owners and for general practice veterinarians. Very useful information. So guys, in my Frenchie video, I concluded that I do not believe it is fair to these dogs to continue making them in this way. If you look at the illustrated breed standard for pugs, I believe we're simply calling for too many anatomical malformations passed off as normal that in fact predispose to life-altering disease. And these diseases require thousands of dollars to diagnose and treat. More importantly, it just puts these dogs at risk for an abbreviated life of discomfort and immobility. Is it 100% of them? No. But is it way too large a percentage? Absolutely yes. Now, in my Frenchie video, I proposed some things that I think are required to kind of change things for the better. And I'd like to do that here as well. So number 1, just like Frenchies, is the breed standard. I think the breed standard encourages way too extreme of features, and it should encourage less extreme features. And the muzzles on these dogs need to elongate to stop encouraging a shape which predisposes to this brachycephalic obstructive airway syndrome. The second thing I wanted to mention with pugs, I think this is a little unique to pugs. I think the demand for these breeds needs to decrease. I think people need to understand that dogs really should not be made to look like a human baby. We need to take a step back and put our own emotional desires to the side and think about the question of, is this a good thing for the dogs themselves to be shaped this way in mass? And then the third thing I think needs to happen is what's called outcrossing. I think this needs to be encouraged as a means to reduce the extreme morphology of these dogs. Pugs have a very high degree of inbreeding like many other breeds, so trying to solve this problem within such a tight gene pool with no genetic diversity is basically impossible. Again, much like French Bulldogs I talked about previously. You need to introduce genes from outside of this limited supply to help with this. Yes, this will change the appearance of the pug, but guess what? That's kind of what we're going for here, and what I would argue needs to be done. All right, guys, I hope you enjoyed this video. Let me know in the comments below if you like the sort of like breed overview of all their major systems and diseases, things that we see. Again, I just want to reiterate, I'm not hating on pugs. Pugs are very lovely dogs. They're very loving companions. I understand all that. I try to help them as best I can. But I do think we need to talk about how they are created and the conundrum that we've kind of gotten ourselves into in shaping them in this way. All right, guys, again, hit the like and subscribe button, leave a comment, let me know what you think, and I'll see you in the next video. Thank you very much. Peace.